welcome to DCA TV. I'm your host Salika J, and I'm here today with Dr. Kindal Robertson, dentist from the practice of Dr. Robertson and Dr. Red Dental Health in Calgary, Alberta. Dr. Robertson is a dentist who believes in patient education as a complement to compassionate, personalized care. He treats patients as if they were family, providing holistic care to promote health for the whole body, not just the teeth and gums. Dr. Robertson received both Bachelor's and Master's of Science in Biochemistry from the University of Calgary and graduated from the University of Alberta with his doctorate in dentistry. Memberships and credentials of Dr. Robertson include Canadian Dental Association, Alberta Dental Association, International Academy of Oral Medicine and Toxicology, for which he chairs the clinical practice guidelines and the scientific reviews, and he is also a certified Invisalign provider. We are delighted to speak to Dr. Robertson today on a few topics, which will give us a clear idea of some of the common dental procedures. Welcome, Dr. Robertson, to DCA TV, and thank you for being on the show today.
Hi, Salika. Great to be with you. Glad you could have me.
Today, Dr. Robertson will enlighten on some of the common questions you may have for implants. Dr. Robertson, can you tell us why get an implant?
So usually there's a need for it, and that's what really starts the whole thing off. Implants are an option for some individuals, but typically what will happen is we're usually between a rock and a hard place. For whatever reason, a tooth's been compromised or it's already out, and we're actually lacking some a body part that we once had. And so the question is how to replace that body part in the best way possible that gives you that really improves the person the most. So there's a couple different options on ways you can replace a missing tooth. One is you can do nothing. Some people choose that and just kind of let the area go blank. And there's some downsides to that in that you now are down a tooth, so you can't chew quite as well. The arch isn't all complete, and the other teeth start to move into that vacuum where that tooth once was. And that can create both some jaw challenges, create some pain, and most importantly, it probably makes it difficult to fix later on. So the longer we leave it, the more difficult it is to fix. Kind of like everything in life. The longer we leave things, the more difficult it becomes later on. Not that that's ever happened to me. A friend of mine, he once had that. And they're good for a lot of people. Sometimes those things are really good. They're pretty easy to put together and get ready for a patient, which is nice, and they sometimes solve multiple problems, but they never really feel part of the patient. They never really feel as though it was them. And so some people really struggle with that and want a solution that actually stays in the mouth all the time. So then we're left with the two different options, either a bridge, which is a really good option, or an implant, which is also a really good option. Both are very successful based on what the patient wants. A bridge uses the teeth on either side, and then an implant doesn't use the teeth on either side, it goes into the bone. So why would I pick an implant over anything else? Again, it's based on the patient, based on their ability to handle different materials, and there's different materials for implants that we can use. We've been using a lot of zirconia lately, but based on the individual's ability to handle different ones, we'll use different ones. An implant I really like because they're independent. It doesn't rely on the teeth on either side. If something goes wrong on a tooth on either side, the implant's not compromised. And probably the most important is the longevity of the implants that I've noticed is the patients who have even really difficult reason have a hard time taking care of their teeth. I think the one patient that has Parkinson's, or another patient that just is getting older and doesn't clean their teeth quite as well as they once did. I'm seeing a lot of decay happening everywhere else, but not where the implants, because the implants can't get decay. Now they can still be compromised, but they seem to be able to tolerate a more difficult environment than any other restoration that I've ever done. So there's really a lot of value to an implant. It's probably the reason why I lean towards an implant for a lot of patients.
Why do people worry about getting an implant? It must hurt to put in?
I think they used to be, and I think they still can be, based on how you do it. But that's not so typically when I work with a patient, they don't hurt. I called a patient last night who we put an implant in, and she's like, yeah, fine, barely noticed it. And so she hasn't had to deal with any painkillers. She's been just great. And so for a lot of our patients, we just don't see that. We don't see that there's a lot of pain, not like there used to be. And that's kind of some of the techniques we use to actually place it to avoid a lot of that. this is probably one of the main reasons people don't get a lot of pain. I think a lot of people are also fearful of just the idea of surgery. But the surgery that we do is so invasive or so non-invasive. It's so gentle that the amount of time that we're in the mouth is very minimal, and they just don't experience a great deal of pain. Anyway, so that's kind of it. Probably shouldn't tell you this one part, so you can edit this out. But I even had even one of my staff, we placed 2 implants in, and I kept trying to send her home, and she said, no, I've got a few more things to do. She just stuck around for a couple hours afterwards, and then barely had any, went to a night class later on that night, right after surgery, which that just didn't be the way it used to be. And if there was ever a time where I would take out a tooth, like an extraction, certainly that wasn't the case with some of those other patients, or even that individual I'm talking about. They just seem to be able to cope with an implant really easily, just really minimally invasive. So we try to do a replacement for the patient.
How long does it take?
The reality is the amount of time we're in your mouth is probably less than 15 minutes. We try to make it nice and quick and simple. So a lot of the time is just spent working around and making sure you're prepped and you have everything that you need. But we really try to minimize the amount of time you're there so that you can be in and out and the procedure can go very smoothly. That's kind of our intent. The more prep work we do beforehand, which there's some significant amount there, the quicker your appointment can be when you're here. So if we have to choose where we want to spend our time, in your mouth or out of your mouth, we choose to do it out of your mouth. So we spend most of the time outside your mouth getting ready for it. And then when we're actually ready to place the implant, we place it. It goes very smooth.
Is it expensive?
Compared to a bridge? Not really. Very comparable, actually. And for the value that you get for it, I'd say it's actually pretty inexpensive. What you get from an implant, the longevity, the durability, and the reliability of an implant really makes it phenomenal. And I think most people manage to make it work really, really well for them. And there's lots of ways to make it work. So, no, I think a lot of people worry about that. I don't think they should worry about that. I think the implants go pretty easy, and they made it place really